Good day, everyone, and welcome to another episode of Skytale Insights. Today, we're going to talk about wellness within medical aesthetics and the trends going into the new year and beyond. Today, for that, very excited to welcome our very own Judy Kozlicki, the head of aesthetics and plastic surgery for our management consulting division. Judy, thank you so much for being here.
Absolutely, Ben. Happy to be here.
Yeah, Judy, I think everyone knows you, but for those who don't know you, maybe you could kind of do a quick introduction of yourself and maybe your vantage point as we kind of head into this very exciting subject today.
Absolutely. So for those of you who don't know, I have been in the medical aesthetic space for over 18 years now. I know that feels like I'm aging, but I'm not, because of all the great longevity and wellness treatments that are out there, and as well as aesthetics, of course. But my background really, began in a single location med spa that grew in scale. So I've been part of growing and scaling operations to 33 locations across about 20 states. So that kind of multi-site leadership, as well as working with plastic surgery practices who also have that non-surgical component throughout my career. Have been consulting now for about 3 years, 2 years with Skytale full-time, love it. And what's interesting is that the wellness piece is not new. I've incorporated those types of services, and we can talk about it more as we go into it, but ever since like 2010, so for the last 15 years at least, we've been creating, that synergy between aesthetics and wellness.
And you were well ahead of the curve there. I keep reading now just, tangentially medical aesthetics with wellness. They're coming closer and closer together. It seems like you saw this coming well before any of us did. So congratulations on that. And, very excited to learn from you here today because, wellness has become a very hot topic. And there was actually recently a McKinsey report, the global wellness market, just so we kind of get started there, in 24 is 1.8 trillion, 480 billion in the United States. And then thematically, what I thought was cool, wellness, it has this maybe stigma about, I don't know, it might work, it might not, right? But what's really neat now is, it's gone from fads to now consumers, per the reporter, asking, what does the science say? And I think that's just so cool and, exactly, kind of where you're going to talk about. So, maybe let's start with, can you discuss just the growing demand for more of an all-inclusive approach from healthcare? Like, these are things that are becoming more and more important to folks. You feel good, you look good, well before, healthcare is usually thought of as, I'm sick. This is actually very different. Can you talk about that growing demand? How do you see it?
Right. People are becoming more proactive, and I think what we've experienced, even though, like I said, I've been involved in incorporating bioidentical hormones, medical weight loss, IV therapy, all of that for a long, long time. In the last 2-3 years is when we're really feeling this upsurge. And I read a little statement that I found fascinating, and I think it's pretty interesting. And it is that if we learned anything from the pandemic, it is how important our health is, our health and well-being. And so wellness is, it's a catch-all phrase that incorporates everything from fitness, nutrition, better vitality, your appearance, of course, but even mindfulness, better sleep, all these things. I think we all experienced so much anxiety during the pandemic, and then also just that fear that we could not be proactive. I think folks are just becoming more proactive about taking care of themselves. And then the lovely synergy that comes with it is, as you start feeling better, if you happen to look in the mirror and don't quite see, like, I feel really great, but gee, my face isn't really reflecting that, that might lean you then towards pursuing some aesthetic treatments. I think the same is true on the opposite side, those who've sought out aesthetic treatments to help themselves look a little bit younger or stave off that aging look. Also, start to look good, but they feel like crap. So they start pursuing, how can I feel better? And what we're seeing is just absolutely fascinating, this upsurge that people can be more proactive, and there's more data and science out there that backs these treatments.
That's fantastic. So if I'm looking at it, you mentioned a few service lines there. If I'm looking at it from the vantage point of a medical aesthetics practice, a med spa, what are some services, some wellness services that you're seeing are being incorporated really nicely within a med spa? What should I think about if I'm thinking of incorporating some of these? Which work well in your opinion?
Well, I think the first and most obvious is this medical weight loss. We're calling it a revolution. It's really, again, not new. If you go back to the days of HCG, that was a big weight loss fad. Started in the 1950s, was popular in the 70s. It came back. I was part of practices that we did this whole HCG weight loss program. It was an injectable, medication as well, along with a 500-calorie diet, so it was not fun. But our semaglutides have just changed the way that we can really approach weight loss, and everything that they're proving, about the efficacy and other benefits from semaglutides or GLP-1s is just fascinating. And so it's a nice add for an aesthetic practice. And maybe we'll get into this as we talk about like how to best incorporate that. I wouldn't just be an aesthetic practice and all of a sudden say, we're offering weight loss now. So again, we can get to that, but it definitely leans towards people who are trying to look good, feel better, right? So we're trying to lose weight, trying to lose body fat, and just look good and feel better. The other one is hormone replacement. And again, it's been around a long time. However, aesthetic practices lean on that hormone replacement option because as your patients start to age, and I shouldn't even say that because honestly, if you blood test some people who are feeling, again, really crappy or fatigued, you could be in your 30s and really feel like that and find out that you have such low testosterone that you need that replacement to help you. And again, hormone replacement has many, many benefits outside of just your hormone balancing, like the typical menopausal woman, hot flashes and mood swings and things like that. But it helps with fatigue and brain fog. It helps with body fat loss as well. So as men or women start aging, we start putting on more weight. We're fatigued, so there's this thing that happens, of course, and we're just tired and we're lazy. And you see men that, become couch potatoes and grow the little belly. And guess what? Men get irritable too. So women have mood swings, men get anxiety and irritability, and we call them grumpy old men. But with hormone therapy, of course, we can really make some life-altering changes. And again, when people start looking better or feeling better, they want to look better too. They want to look that age.
That's a great point. And I think you touched on that a little bit, that one complements the other. If you're into wellness, might drive you into aesthetics. If you're into aesthetics, might drive you into wellness. And as you were saying that, and as you were explaining this, the weight loss plus HRT, hormone replacement therapy, it brought to mind as you were speaking, we published a white paper, and one of the really fascinating findings, this is more on the financial side, but a pretty high percentage, I think it was over half of the patients coming into med spa that's offering weight loss, they were never part of that med spa. They actually hadn't been treated with aesthetics before. They went in only for that. And a high percentage of that, I think over 70%, ended up taking aesthetic services. So it's this really nice way to also, it's very additive to the practice. It brought on new patients that didn't exist before, which, proves the point that you made earlier of, it's a bit of a yin and yang. One complements the other very well. So that's exciting. Now, if I'm considering, adding HRT or weight loss, do I just add it, or, what are some factors that if I'm a med spa owner, I ought to consider before adding, any of these services?
Yeah, your biggest thing is one, check your state regulations for who can provide the services. You have to think about now we're prescribing medications, and what is the credential of the provider that you need to offer those services. And I think that's really the main one that people have to remain focused on, is making sure that I have the right person in the right seat to offer the services. It's not a nurse, it's not an LPN, or et cetera, that can prescribe. So if you don't have an MD, it is likely that you will need to hire a nurse practitioner or a PA to offer these services. You also need to think about the time spent. So these patients and just these programs require a little more hand-holding. There's lots of ups and downs that you can do as you're trying to balance hormones. Weight loss is a pretty seamless, easy journey. However, some people might have symptoms or, some issues along the way that stumble. So you want someone who is able to provide that care, that ongoing care. It's not an immediate gratification type of procedure like injectables that were in, out, and you look great, bye-bye. So a lot of follow-up. Thinking about, so we said your regulations, your staff, who you employ, and then really important that we think about hiring somebody who's really passionate about it, somebody who will own and champion those services. This is where I start thinking about the med spas that just want to add weight loss because, hey, it's making a lot of money right now and I want to add this new service line. If you don't think about it holistically and how you will then continue the journey for your patient into aesthetics, and you're not thinking of that right from the start, that's where people stumble. And you really won't experience that exponential growth that a lot of practices are seeing. So thinking about incorporating a very comprehensive consultation right from the get-go and talking about the things that will occur aside from weight loss. You might have some volume loss. You might have skin laxity. You might actually lose muscle mass. So what are the things that we can do internally to help you with that? We have biostimulators such as Sculptra, Radius, et cetera, and that's another one, right, that's coming on very strong and you could add to your practice is the regenerative medicine, PRP, PRF. But those biostimulators help with volume loss. That Sculptra was first introduced for AIDS patients because they became so gaunt and they needed that volume just to look healthy and vital again. So you think about that, and we can use M-Sculpt Neo to help maintain muscle mass, or M-Face, even the muscles in the face, as we're losing that muscle tone and texture. And then, of course, you've got all other kinds of devices like Morpheus 8 and, things for skin tightening, the soft wave, and lots of things that you can incorporate. And I think practices that are really doing it well have figured that out, and they don't wait until the patient has lost the weight to make those recommendations. They're talking about it right from the get-go.
I love that. I really like the way that you brought it all together. It sounded just like a great patient treatment plan. And this is completely tangential to this, but it just brings to mind what some of our clients even ask of how do you train your staff to not look at it as you're selling things. And exactly what you said, I think, is spot on. If I'm a patient, I want you to tell me and guide me as to what my journey is going to be from a treatment planning perspective. And I think the way you tied that together was pretty exciting. So thank you for sharing that. What about, can you think like practices like you just mentioned, a pretty ideal situation there from a treatment plan perspective? Do you know of any, and you don't have to list names, practices that are doing it extremely well? And if so, could you maybe thematically just talk about what that looks like?
Yeah, that really is the main thing, is that practices that are doing very well have figured out not only how to have that comprehensive consultation and make all those recommendations, they're incorporating even packaging, right? Or if we develop any kind of a subscription plan, it'd be nice just to throw in an M-Sculpt just so someone experiences it once. That's a device that I absolutely love for a wow effect because you know it's working, you feel it, activate your muscles, so you know it's going to do its job. So any way that we can bundle or incorporate those extra treatments, practices that do it well are doing that. The other thing is, you mentioned it, train your staff. You really have to train every single person in your practice. I remember when we introduced bioidentical hormones into one of the plastic surgery practices that I was at. We trained everyone from the front desk to the MAs, to the providers, to the OR staff. Everybody needed to know and understand what this meant and why it was beneficial for our whole patient base, whether they were a surgical patient or an aesthetic patient. And so having that clear understanding, doing huddles and one-on-ones and or team meetings where you're helping, professionalize that talk track about it. And then third, I would say it's the personal experiences. So when your staff, whether it's you as the owner or any of your staff members actually experience some of these amazing results, you need them to tell the story because it's not something that you can very easily, just blast on a, Facebook ad or an Instagram ad that you're offering it. It really is the patient journey and those self stories, really the heart of testimonials, whether it's our patients or us, what we share is so critical.
Yeah, and so any of these practices, you mentioned one at least that you were personally a part of. Have you seen any of our clients incorporate wellness successfully into their medical aesthetics practice?
Absolutely, yeah. I took a look recently, and about 60% of our current clients that are really began as aesthetic clients are offering wellness in some capacity.
Oh, wow.
Yeah. And yes, some of them are just in that weight loss kind of arena, but more and more are venturing into the rest of that whole regenerative medicine. We also are seeing more and more new clients that are coming to us as that functional medicine or regenerative medicine type of practice that might have aesthetics as an ancillary. So it's very, very interesting and fun to see the growth in this area. I'm going to give you this little personal note. My father was a chiropractor, and he was a chiropractor back in the day that was really not very supported by the medical community. So he was a pioneer in my mind, and he really believed a lot in a lot of different holistic kind of ways of treating and proactively or preventatively treating the body. And so I guess I've always had a really open mind to outside of traditional medicine therapies, and that makes me, just a wide open target for working with these types of practices to incorporate it. So it's been fun.
That's great. It sounds like your father rubbed off on you quite a bit.
Yeah.
So, I mean, you were doing this 15 years ago with wellness,
Yeah.
I think you said earlier. So that's exciting. Now, okay, you have, I'm a medical aesthetics owner. You have me excited, Judy. I want to add this. Arrow to my quiver here. Anytime I think about adding new service lines here, even at our firm, financial considerations come up, right? How much is it going to cost? When am I going to break even? What are the timelines whenever I do mature? What's the profit margin look like on these things? Who do I need to hire, which you touched on a little bit? What are some financial considerations if I were going to want to explore adding some of these service lines? How would you look at this?
Your initial financial investment is really in that training, or perhaps back up. the hiring and recruiting of the right staff member if you don't have them on your team, right? So think about who you have on your team and what their credentials are. If you have to hire, then hire. But the training involved, this is where I think people miss a little bit of the investment that you need to make is really, and I'm going back to hormone replacement, I apologize, but it's top of mind for me. It's endocrinology. And so there's a lot that goes into it. And so investing in really getting a good understanding of how to treat a hormone patient. Same with weight loss. There can be, like I said, symptoms and things to manage. And somebody, all the science and backing behind regenerative medicine, we need somebody who's really credentialed. So that training expense is huge. And I have seen this happen where you bring someone on, you invest in that training, and maybe 2 years later, they're gone. Yes. So don't just train one provider. Like, you need to actually have, and I think really, truly, as a medical director, they should be heavily trained in what you're going to offer as well so that they are that backup. So that's the biggest one to me because, again, think about that reinvestment you'd have to make if you have to rehire. Profit margins are good. They're healthy. They range anywhere from 30 to 50%. Wow. And so the real key is that is patient retention. These types of treatments are like you have a patient for life.
Yes.
When you help someone feel better, no one wants to stop. I, for one, will never stop. I am on bioidentical hormones and have been for some time, and I can't imagine. So I know when they're wearing off. I can tell the difference, the brain fog and the forgetfulness. So there's that. I think weight loss, in our minds, we think it's a quick fix, and I think that is a little bit of a bad rap of what can happen, and that's true. Patients can abuse it. They can use it and just lose weight and go back to their old ways, and sure, they will absolutely gain it right back. So again, thinking about the longevity and how you retain that patient, helping them maybe with more nutritional counseling or coaching so that they can maintain more of a healthy lifestyle and make the changes necessary to maintain that weight loss. It just is, I think that's the biggest benefit of this category that comes to aesthetics. It's not a one and done. There's obviously marketing costs. You have to rethink. And really, when you think about the marketing piece of it, side note, make sure that this fits your brand, right? That it hits your patient avatar. Think of your client base that you currently have and that you're serving, and does this make sense to offer? Yeah. But obviously, there's an investment. Anytime you're launching new service lines, you've got to market. And then just ongoing expenses are, the typical medical supplies. You'll have a lab partnership. You'll be, outsourcing maybe to a compounding pharmacy, a lot of these medications there. And just one last thing is to think about there might be an increase in your liability insurance to add these services under.
Good point. Yeah, one of the things you just mentioned, Judy, was you can tell when some of these services wear off, which means they work. And it brings to mind the article I mentioned earlier where the theme was that folks getting into the space now, users, are asking, what does the science say? Whereas maybe before they didn't ask that as much. And, just some interesting stats. The market's growing 5 to 10% a year, the wellness market is. So really nice growth. And then this one's interesting. 82% of U.S. consumers consider wellness a top or important priority. And furthermore, the growth is driven by Gen Z and millennials. So you mentioned you'll have a patient for life, which is, Gen Z millennial, that's a big long-term value patient there. And so coupled with that science comment and the growth and the high priority that folks are placing in this space, as you mentioned, after COVID for sure, do you have any examples on, any of the increase in acceptance of any specific services due to science and other scientific advancements. Can you talk about that a little bit?
I can a little bit. I would say, the studies that have come out that have proven like all of these things actually started so long ago. Semaglutide, I think I just learned, was actually initially discovered, that peptide back in the 1900s.
Wow.
Yeah. So it's like everything. As time goes on, we learn more, science gets better. We just dive in more, and the proven studies really show and look at what we're proving again, or what science is proving about the GLP-1s and all the different things that it can affect. We're learning more every day. So that is one for sure. I think it's here to stay, for many reasons, not just weight loss, right? So the science behind the regenerative medicine and peptides, semaglutide is a peptide, right? There are many peptides that have more and more scientific information or backing behind them. I can't name them, but it's definitely becoming, I love that you named that's a trend, that our younger generation is looking for more science and not just looking for a fad. It's no longer just the influencers on Instagram that are driving things. They're actually studying about it, and they want a recommendation from a clinical person, to move forward with that choice. I don't know if that answered your question there, but.
No, it does. That's helpful. And then, as you look at this, we've talked about some of the services that are here to stay, as you put it. Do you see anything that's emerging, maybe right around the corner, or new technologies that maybe our listeners should keep an eye on, or what do you see around the corner that you want to share with us?
I think that the corner is about to shift into really understanding more about that regenerative medicine piece, and how it's, again, affecting more things than just the body and health, but we're looking at brain health. We're looking at sleep optimization. We're looking at mindfulness studies. So we are truly becoming more and more holistic. And what can we utilize in our own bodies, like our PRP or PRF? What can we affect that's in a natural way but science-backed, is really what's happening. So, additional things are cryotherapy, right? The cold plunges and things like that. The red light therapy, again, has been around so long, but now all of a sudden we have red light beds, and we're proving that it's helping blood flow, inflammation, recovery. Think about a surgical patient who wants to expedite their actual recovery from surgery. So we're not just talking for athletes, but in these aesthetic practices, again, the benefits of that. So I think we're seeing more and more surgical practices even embrace those things.
That's exciting. You mentioned a few things there that I'm going to have to go research now. I know sleep, for example, is one that's caught my eye recently, just because my thought is, if you're going to spend a third of your life or so, probably less than that, but sleeping, you probably ought to take a look at that. There could be something interesting there. So you threw out a few interesting pieces. Another crystal ball question for you, Judy. What do you predict here coming into the new year, 2025, or, to not constrict you too much? You can go out further if you like, but really the question is, what are some great predictions from you in 25 and beyond?
I would say, one, wellness in general is here to stay. So that goes far beyond 2025. Weight loss, due to utilizing the semaglutides or GLP-1s, is here to stay. I know that there's a lot of hubbub and concern, about, we've got big pharma involved in these, as well as our compounding pharmacies. And a lot of practices that didn't embrace that were concerned about, that piece of it, like what happens when Big Pharma says it's no longer on, back order or deficit. So the point is our compounding pharmacies are working very hard and they're not going to let go of it. So I think that is here to stay. And I think we're going to see, like you said, the younger generations, those Gen Zs and millennials, really embrace a healthier, more proactive lifestyle. And so, again, I think you'll see more and more of this really incorporated into what we're going to now call longevity. It's no longer anti-aging. Anti is kind of a negative word. We just want to extend life, but extend life in a way that we still feel good. Nobody wants to be 95 and feel like crap, right? We want to live to 95 or 100, but feel like we're still 25.
Yes, so, that would be great.
Yes.
That would be a good goal to have.
Yeah.
That's great. Now, I always like to end things with, kind of some sort of call to action or checklist, or what's some good top advice from you, Judy, if I'm a med spa owner that's looking into the wellness space?
Yeah, I mentioned some of these earlier, but they really are. The most important thing, I think, is to hire the right person or identify that person on your team that will champion these types of services and incorporate it into their everyday talk. And when you have somebody who's passionate about it, that passion just exudes and it grows. It snowballs in the practice. And that's what you need, not just a one-off. You don't want somebody who ends up siloed. So really think about who's your champion for it, and then train everyone on your staff. Make sure everyone understands. And I didn't say this before, but I will add that like ways to incorporate successfully, like even hormone replacement into an aesthetic practice, is you should be asking every single patient, hand them a symptom questionnaire. Every patient. They may not be there for that, but these are ways to start the conversation. So it's important that your front desk or whoever's greeting or rooming that patient can also speak to these symptoms. Yeah, if you check these 3 boxes, you actually could be a candidate. So big, important piece. And then again, share the personal journeys, tell the story, do video testimonials, put people on, your Instagram stories, but share, because that personal success story is really what is moving people to give it a try.
Yeah, I like what you said about handing the patient a list of how you're feeling. I mean, doctor's offices do that already, and I've had a few friends that do some of these services, and even some that do things like sleep apnea. And I think when you're in your own day-to-day, you think that how you feel is normal. And it's not until you start figuring out, oh, you know what? That wasn't normal. Now I feel so much better. Yeah. So a lot of us don't know that we may need some of these services. So I really, really like that point. Be proactive. Treatment planning again.
Yeah. And aesthetic practice has been, that's the thing, that's the transition for them, right? We know people are coming in for XYZ. I'm coming in for my Botox filler or my laser treatment, et cetera. How do I have this conversation that like, how are you doing sleeping? How are you feeling? Are you, experiencing any hot flashes or, night sweats? Or are you, it's a weird conversation to bring up. Include in that, by the way, sexual wellness. That's part of this whole revolution, is that for women in particular, their sexual health is now becoming a priority. And so again, how do you have that conversation when you're just getting your Botox or your facial? So I think a very easy way is that just give them a symptom questionnaire, and then as you're reviewing everything, it's like, oh, by the way, yeah, we can actually help you with that.
Yeah, it's very good advice.
Yeah.
Love it. Thank you so much, Judy, for coming on and sharing your wealth of knowledge. I know I certainly got a lot out of it. I took some notes. I'll probably do some research after this as well on some of the things you mentioned. Thank you for your time.
Thank you for having me.
And thank you, everyone, for listening to another episode of Skytale Insights. We hope you enjoyed the episode, and please subscribe to us.